quarantine worker contracted the highly infectious UK strain of the virus. But it's been revealed that a Victorian woman who flew to Queensland on the 5th of January is still testing positive to the UK strain despite completing quarantine in Melbourne.
Less than 24 hours after the lockdown took effect, Brisbane streets were largely deserted, but people weren't going without their morning coffee.
Busy morning or?
Very busy.
Masks are the new fashion accessory and the panic buying of yesterday is over.
The staff's been working really hard overnight, restocking, which I realise that they get deliveries every day.
Nearly 15,000 Queenslanders have been tested for COVID-19 in the past day, with no new cases.
So congratulations everyone, but of course we're monitoring the situation very closely over the next 2 days.
Contact tracers have identified 91 close contacts of a hotel cleaner who tested positive to the highly contagious UK variant. But there's more concern about the woman's community contacts around Brisbane between January the 2nd and the 5th.
All of those people, whether or not you have symptoms, I would like you to come forward and get tested no matter where you are.
Authorities are also monitoring the contacts of a second woman who flew into Brisbane on the 5th of January. Despite testing positive, she was cleared to leave Victorian hotel quarantine after 10 days. The decision was based on old national protocols which didn't require exit testing, only that cases be asymptomatic for at least 3 days.
That is now being changed as a result of AHPPC's recommendations and National Cabinet's decision.
Genomic testing subsequently revealed the woman was infected with the UK strain of the virus, prompting Queensland authorities to retest her yesterday. That test was positive. As a result, passengers on board Jetstar flight JQ570 to Brisbane that arrived at 11 p.m. on the 5th of January are being urged to get tested, as are Mullaney residents in the Sunshine Coast hinterland where the woman's staying with her parents. An alert has been issued for 3 locations in town, including an Italian restaurant, a bottle shop and Woolworths supermarket.
The risk is extremely low, very, very, very low, because she is right at the end of her potential infectious period.
Mullaney residents aren't required to lock down or wear masks, but some are being cautious.
So we're sort of socially distancing and not coming into town more than we need to.
Things can just go completely chaotic overnight. It's pretty desperate, really.
While it's mandatory to wear a mask in Brisbane, police say they're taking an educational approach.
We will give you a mask.
Even so, 4 people have been fined for not obeying a direction.
And in 3 occasions, those persons were actually offered the masks, refused to wear them.
The next 2 days will be critical in determining whether the lockdown can be lifted as hoped on Monday. Daya Clark, ABC News, Brisbane.
Australia's one local COVID case today is in New South Wales, and it's already been connected to a cluster. There's been a brief scare. A patient who was released from a Sydney quarantine hotel has been found to be still carrying the mutant UK strain. Officials say we're going to have to adapt to this new variant, and police are investigating a large gathering of rev heads to determine whether they've breached crowd restrictions.
Rev heads would usually get their fix in the nation's capital at this time of year. But COVID's meant Summer Nats has been canned, so they put on their own show.
It just amazes me at the stupidity of some people.
Car lovers also tore up the streets just over the border at Eaglehawk. More than 60 vehicles dispersed when police arrived. It's the crowd's size raising the eyebrows of health officials.
There's a gathering order that says outdoor gatherings have to be 30 people. Depending on the nature of the gatherings, they may be in breach.
Police are using these social media videos and CCTV footage to determine if they broke the health order. New South Wales Health has been busy with an investigation of its own after a scare involving a mutant COVID strain. A woman was released from a quarantine hotel after she'd recovered from the virus earlier this week, but she was later found to still be carrying remnants of the new UK variant. The patient has returned to quarantine and alerts have been issued for the venues she visited in Sydney's inner west. Authorities are confident the woman wasn't infectious in the community.
The virus is changing and it's important for us to make sure we keep learning.
That includes extra precautions at quarantine hotels. Staff will be tested every day, so too will overseas-based aircrew when they touch down, and guests at the end of their 2-week stay. That means an extra 13,000 swabs will be taken in Sydney every week.
It's just 2 weeks shy of 1 year since we had our first cases here in New South Wales, our first 4 cases. And of course it continues to be a journey.
The Northern Beaches is counting down to the end of lockdown at midnight. A chapter all hope won't be repeated. James Carmody, ABC News, Sydney.
Well, there's been a last-minute scramble for many people to get home as more states impose border restrictions on the Greater Brisbane area. Passengers arriving in Melbourne from Brisbane have expressed frustration about the Victorian government's rule changes.
Once the virus epicentre of Australia, Melbourne has become a safe haven.
Relieved, very relieved. Can't wait to get home and isolate.
But other passengers who also spent time in Brisbane say they weren't told at Melbourne Airport about the official advice to get tested and isolate at home until 6 o'clock on Monday night.
You should not have been on that flight if you were from those, I think, 5 local government areas, in fact. And that's an issue for the Queensland government.
There's similar confusion for travellers who only pass through Brisbane from areas that aren't locked down, such as the Gold and Sunshine Coasts.
They didn't specifically tell us what to do, but we know I'm a GP, so I know that the right thing to do is to follow the advice and isolate, and I suspect till we get a negative result.
We had a rental car straight in to the airport and out we went, really.
We were worried that if we had entered the red zone that then we would be subject to 14-day hotel quarantine.
Well, I think Melbourne Airport have run loops through their PA system as to what the measures are. Victoria has DHHS authorised officers, nursing staff and other professionals out at the airport meeting flights to make sure that this message is got through.
Robert Cameron is isolating in his Fitzroy home. He visited regional Queensland and flew out of Brisbane Airport last Saturday. He was sent a Health Department text message yesterday about getting tested and staying put.
When I called the DHS this morning, they didn't know what I knew.
It seems like between the Department of Justice, DHHS and the authorised officers here, no one seems to know what's going on.
Niharika Anand flew home from Sydney on New Year's Day after the border closed and was put into hotel quarantine.
When I was called about my exemption, they still thought I was in New South Wales. There was no update. DHHS was not aware that I was actually sitting in hotel quarantine.
Late this afternoon, she was given permission to finish her 14 days at home.
The government has not been able to organise and get messages right.
The state government has clarified that returned travellers who test positive only have to do 10 days rather than 14 days in hotel quarantine. But from Wednesday this week, those with the UK strain of the virus must do the full 14 days. James Hancock, ABC News, Melbourne.
The more contagious UK strain of coronavirus has been detected in the international arrival side of the Northern Territory's Howard Springs Quarantine Centre. Now, health authorities have today confirmed that a repatriated Australian has tested positive for the strain, but says there's no cause for alarm.
2,500 Australians stranded overseas have now been brought home through the Howard Springs Centre. Today, authorities confirmed one of them has the particularly infectious UK strain of coronavirus.
A traveller who arrived on the 30th from the United Kingdom has tested positive to the highly virulent strain.
The 26-year-old woman who had tested negative before leaving the UK returned a positive test after arriving in Darwin. 11 days later, interstate testing has confirmed it's the UK strain. Health authorities say she was already properly isolated from other people in quarantine and staff.
She had been already isolated on the 31st when her test results had returned and has been managed safely in isolation since that time.
We take nothing for granted. We have a very specific hot zone, which is an isolation zone that people are placed in if they become positive of any of the aspects of the virus.
They say the woman was travelling with a companion who is now also in isolation but has returned multiple negative tests. Authorities here at the National Critical Care and Trauma Response Centre say they'd already been planning for the potential for the UK strain to reach the Northern Territory, enhancing protocols at the Howard Springs quarantine facility.
We've always had very stringent processes on site, but in addition we started, instead of just weekly testing of our staff, we started daily testing of our staff.
Health authorities say other passengers and aircrew from the London flight have all tested negative twice for COVID-19.
We will maintain that vigilance, test all those who have come in contact with her that we know of, and of course do the entire group prior to departure from quarantine.
There can be no complacency, and we must all, as a community, maintain a high level of vigilance.
Also today, a 27-year-old woman in Howard Springs tested positive for COVID-19 after arriving on a flight from India yesterday. There are now 21 active cases of coronavirus in the international side of the quarantine facility. Nicholas Hines, ABC News.
Let's now check the situation globally. America is struggling to contain a record surge in COVID infections. The US is setting daily records for infections and deaths. In just the past 4 days, more than 15,000 people have died. Cases are surging across Europe too. The UK and Germany are among the worst hit at the moment. The World Health Organization says globally the situation is grim.
Over the past few days, we have seen some of the highest numbers of deaths recorded at any point in the pandemic.
The WHO says people are putting their loved ones at risk by not complying with mask wearing and distancing measures, and that's putting more pressure on frontline health workers. Jenny Lavelle has the story.
Inside a California hospital ICU, and exhausted health workers are bracing for another surge.
Because you're on high oxygen.
Already at capacity and patients flooding in, doctors at this hospital say they can't build beds fast enough.
We're doing everything we can to try and set up more and more space, but we are pushing our carpenters and facility people to an extreme.
After avoiding surging cases for months, the virus is raging out of control in California. Testing queues stretch for kilometres, and the unprecedented caseload for workers is taking its toll on staff.
I've seen more people pass away in the past couple of weeks, really, than I almost like it combined in all of my career as a nurse. It's been really hard, physically and emotionally.
The White House Coronavirus Task Force says the acceleration in cases could point to a new variant of the virus in the US, but didn't provide further details. Cases are surging across Europe too. Germany has just recorded its highest ever death toll, just days after tightening a national lockdown. Authorities say they had to act, with someone dying of the virus every 2 minutes. In London, 1 in 30 people now have the virus. The city's mayor has declared a major incident, warning hospitals are at risk of being overwhelmed. They're so busy, ambulances wait in long queues for hours to hand over their patients.
Is everybody ready? The patients are very poorly and in bigger numbers than we've ever had them.
They're not old patients, they're a younger cohort, and so it is really, really difficult, and we are all at times finding it quite overwhelming.
The WHO chief warned wealthy countries not to stockpile and over-order vaccines.
This potentially bumps up the price for everyone and means high-risk people in the poorest and most marginalised countries don't get the vaccine.
Just like in Brazil, where the need for inoculations grows more desperate by the day. Its death toll has just passed 200,000,
And with space running out, authorities say they'll soon be forced to bury the dead in vertical graves. Jenny Lavelle, ABC News.
A politically wounded President Donald Trump will sever 150 years of tradition and boycott the inauguration of his successor this month. Amid demands that he resign and with impeachment threats swirling around him, Trump has announced that he'll skip President-elect Joe Biden's ceremony. America is still rattled by the siege of the Capitol. Trump's had his Twitter account shut down and a flurry of charges are now being laid against some of the violent invaders. Greg Jennett is in Washington, D.C.
They broke through, it's on!
Besieged and overwhelmed.
It's over! You better run, cops!
Capitol Police lost spectacularly, lost control, lost protection of the Congress and lost one of their own. In a grey half-dawn, with a flag half-hoisted, they remembered him. 42-year-old Brian Sicknick's killing, beaten with a fire extinguisher, is the subject of a murder investigation. The net's already drawn in on the Arkansas man who commandeered the Speaker's chair, and 13 others have also been charged. But what of the man who encouraged the unrest?
I think it's important we get on with the business of getting him out of office. The quickest way that will happen is us being sworn in on the 20th.
That's a ceremony Donald Trump won't attend. History's chain of the outgoing president handing over to the elected successor will be broken by him in a fortnight.
One of the few things he and I have ever agreed on. It's a good thing I'm not showing up.
Predictably, Mr. Trump had tweeted his intentions to 88 million followers. He won't get to do it again. The company's now permanently suspended his Donald Trump account due to risk of further incitement of violence. And its assessment, Mr. Trump plans to continue to support, empower and shield those who believe he won the election.
We will never concede. It doesn't happen.
Silenced and politically isolated, this presidency could yet have humiliation heaped on it. Although Joe Biden's lukewarm at best, Democrats are still threatening possible impeachment proceedings, and a small number of Republicans say they're open to considering support.
Donald Trump has acted shamefully. He has been in flagrant dereliction of his duty.
In one final ignominy, House Speaker Nancy Pelosi sought out the military's top commander for an assurance that there are safeguards against an unstable president ordering hostilities or nuclear strikes. The general answered her questions. There are always multiple layers of legal and technical controls on both.
Ever the disruptor and now widely held in disdain, Donald Trump's breaking a century-and-a-half tradition by not showing up on Inauguration Day. Yet in view of the implosion of his party and his presidency these last few days, perversely, his absence will aid a smoother transition to Joe Biden. Put simply, he won't be missed by many inside the now heavily fortified Capitol, where the 46th presidency begins. Greg Jennett, ABC News, Washington.
Returning home, opposition leader Anthony Albanese has walked from hospital following a serious car crash that saw him being T-boned by a Range Rover.